Hey, so we're just cleansing your skin, getting prepared for our microneedling treatment. Hello, everybody. I'm Rebecca Piery, and I'm so excited to be showing you how I microneedle with exosomes we chose today. This is our beautiful model, Dr. Sabriel. You've had microneedling done several times to your face, right?
Yes.
So with exosomes, it's not just a one-time treatment. I mean, like anything in life, right? Can't go to the gym one time. Exosomes, I like to do it here in a series. With the exosomes I'm using today, I really think the best protocol is once a month for 3 months, and you're going to get an amazing, incredible treatment. Even just from one treatment, depending on what a patient's skin looks like and what they could afford, one treatment, you're going to look amazing. What I'm expecting to see with you today is an overall just incredible evenness of your skin coloration. You're going to notice the fine lines and wrinkles dissipate. We're going to notice a lot more collagen, elasticity being created, but also within the pores shrinking. This just enhances any microneedling treatment. A lot of people use different exosomes. These exosomes have billions and billions of cells in them. So it's a lot different than some of the other products that you see at a lot of aesthetic spas. This is definitely 10xing your exosomes. So yeah, so this is going to be exciting to see your results. So you ready to get started? So today we are combining two different exosomes with a specialized skin exosome and a body exosome. So I'm going to go ahead and draw those up now. I'm going to mix them. So I'm choosing to draw them up just because I had it here with a 16 gauge needle. Unlike cellular therapy treatment, this doesn't have the live cells in it, so your needle doesn't need to be this big. I would choose at least a 20. And the microneedling pen today I'm using is the Rejuvenation. I have the skin pen. I've done them all. There's a lot of great microneedling devices out there. Okay, I always get the bubbles out without that needle. So some people do mix this, and you can make it a thicker constitution with a hyaluronic acid just to thicken it up so it stays on the skin. We don't want them to drip because it is a very thin product. We're going to create a lot of microchannels in your skin. As soon as I start seeing blood, we're going to deliver the exosomes into her skin. I'm using the Rejuvenation, and I brought a couple different needles down. We'll just see how it goes. Typically, we would use lidocaine or a numbing agent to numb the face. But when you're using a cellular therapy treatment, we don't want to use any lidocaine because it can kill those cells. So our patient here is a toughie. She's done this enough where pain doesn't bother her. And so she doesn't want anything. But typically, we'd offer Pronox or use a Zimmer. Okay. I'm going to start at a 0.5 depth just to see what her skin is like.
Okay.
Sometimes you need to go a little bit deeper based off of the patient's skin. But we're going to see here. We're going to start on your forehead, okay? So as you can see, the 0.5 depth is just perfect. I don't need to go any stronger. I like to use a stamping method because we just want to open up all of these micro channels, right? So we can deliver this incredible cellular therapy treatment and all these billions of cells right into that area. You're doing so good. And I'm just dropping the cells in. So since this is not a live cell, we can really just get it in there. The forehead does bleed a lot more, but you wouldn't want to go any deeper on this treatment. When you go deeper, your body actually bleeding more, it coagulates and doesn't allow the exosome or cellular therapy treatment that you're delivering in there to actually penetrate the skin. So just right when you see that pinpoint bleeding, just know that that is enough. And you change the depth for every area of the face. Do a lot more passes in an area where you know the patient has fine lines and wrinkles. Okay, halfway there. I like to use this stamping method. I see a lot of providers that do more of a swirling method. I was taught this French technique by doctors years ago, and it just makes sense to me. I find that the swirl or dragging, it creates micro tears in the skin, and you are going to bleed more. So when people call it this vampire facial, you don't necessarily want those micro tears into the skin, number one, and you don't need all of that blood. As you can see, this just tiny little pinpoint bleeding is exactly what we need, because now we know the body's not going to go into healing mode and coagulate and stop the bleeding. It's just going to allow these cells to really suck right up in there. So making it a little thicker with hyaluronic acid will stop that. You're doing so good. All right. Give a little break. I put a little needle on the tip of this. Needle will not be penetrating in the skin. I just wanted to slow down the delivery of the exosomes into the skin, so I'm just using it to drop it right on in. I'm going to lower my depth when you're working around the eye. There's no need to go real high, but I do like to get right on up in here. So I pulled this down. Okay. And if you need to squinch, go right ahead. Sometimes it makes it a little bit easier. And so now I'm just working very lightly. There's not too much pressure on my hand. And see, I'm just trying to create this pinpoint bleeding. That's all you need on here. You do not need to be too aggressive. This is my favorite treatment to do, microneedling on people, because
the eyeball.
Well, just the whole thing. I love this treatment when you're doing it correctly, and you're going to get the best results.
Yeah.
So the stamping technique that I use does take a little bit longer, but it's worth it. It's a really good way to ensure that you're not wasting any product. No needle is going into her skin. We're just dropping it out. And I'm putting it in all these areas that I microneedled. I'm just kind of going slow, doing one little area at a time. While these little microchannels are open, this is going to ensure that this goes right into her skin. And I just give it a second to kind of sit there and let the body suck it in, and then you can gently massage it in. And then I will go over it one more time as well to ensure that all of this gets absorbed into the skin. So I really like to use light stem or any light activated panel you have. Light, hyperbaric chamber, oxygen work really well with a cellular treatment. So after this, not only will we use the red light panel on her face, it'll help activate the cellular therapy. It'll work just fine without it, but it works even better with it. And the great thing about it, it helps the inflammation. We want the inflammation in the skin, but it helps penetrate the product even deeper, exactly where we want it to go, and just helps promote the healing of the skin. So,
Oh, my dear.
oh, you're doing great. Your skin is looking great. So I'm going a little higher up. When you're working in this part of the face, the skin is a lot thicker as opposed to the forehead. There's a lot more bones, so you're going to get more bleeding. Nerves too. If your client sneezes, it's totally normal. I can't believe you didn't actually. Working around the eyes, also very thin skin, so you're going to want to remain at a minimal depth. But I'm going to go up to 1 here on my pen. And you can see even at 1, there's not much bleeding, but I can see if with another pass I might get that pinpoint bleeding that I'm looking for. And if not, I'll just go up a little bit higher. And that's just in these thicker areas, right? And you can do this like just to follow a pattern on it, just like you would if you still do microdermabrasion. Follow a pattern, go one way, and then go the other way. It's called a crosshatch, but that way you can make sure to get all the areas. If you're at least getting 70% of the face, so even if you have little gaps, you're at least getting 70% of the face, the cells are going to cover everything underneath it. So if you notice you missed a little spot on your patient, it's totally okay when you're working with any cellular therapy treatment, because underneath the skin, you're covering it all. One place everybody always misses is right here on the ears. That's where you notice aging the most, you know? So I even go on the earlobe here. So with this treatment, you're not going to want to wear makeup for 48 hours. I'm going to give you some aftercare. Aftercare is just gentle, you know, right? Just, again, it's nothing to manipulate the product, but anything with like a hyaluronic acid, you're going to want to stay away from any retinols or vitamin C's because that would burn. We don't want to take away from what we just put in your skin. So less is more for the next 48 hours. Sunblock, of course, after we'll leave today with a hat. Today I'm going to leave you with the aftercare that I want you to use, and then we'll talk about it again. So you can do this over the lips as well. I love it over the lips.
Yeah.
Gets rid of all of those fine lines, wrinkles, and really rejuvenates the lip. She has done so well. Remember, this is without any numbing agents, no lidocaine. I'm going to finish off on your nose and lips, and we're golden. You can scrunch like this. Look at me. Yeah, this is great for the larger follicles on the nose. You'll want to make sure before you do this treatment that your client has clean, exfoliated skin. So which will ensure that the product will go right into their skin. Ooh. So I do a dry pass to open up the microchannels. And then I lay the product on, and then I do another pass to really make sure they're delivered. And you can do a slight rub to rub everything in. Okay, we're going to finish off with the last of our products because we did your full face already. And that's with 2 cc's. And as you can see, I still have 1 whole cc left. So that's quite a bit. So I'm going to do your lips and then 1 more very light pass, okay? So get the product all over. All right, so for my last pass, I'm going to finish off with the rest of the exosomes, and then I'm going to put a little bit of hyaluronic acid on top, and then I'm going to finish off with the light stem to make sure that we get all of this absorbed into your skin. I like to put a hyaluronic acid on top. It's just a little bit more emollient, which is going to really make sure that the product stays exactly where I put it and keeps it kind of trapped in while she's under the light. You did it.
Wow.
Yeah. All right.